Hi, it's Dr. B again, here with Brain Bites. So, this week, what I'm here to talk about is just briefly update a question that I got about generics versus brand name medications. So, I didn't talk about this in last week's video, so I'm going to talk about it now. So, the question was specifically about how similar generic medications are to each other. So, according to the FDA, when mens get up the first time, they go through a really rigorous process of testing. So there are animal studies, and then there are human studies, and the trials go on for a long time, and they get a lot of data about the medications. Then once that's approved, they go through the manufacturing process, they study the chemicals and the action, and they look at all this stuff. Those really new medications, when they come out, they may really help the right person, but they also cost like $1 zillion. And it's a long process. As we talked about last time, the new medications don't also have that long trajectory of information that we're often looking for when we're thinking about prescribing a medication long term. So there's that piece. Okay, let me look at my notes. Okay. So the medications, when they're made like that, they get a patent. And usually the patent lasts between 7 and 10 years. Once that patent is up, other companies can make that same medication and sell it as a generic. So they go through an expedited process with the FDA. For these new generic medications that are looking for approval, the active ingredient for the medication has already been developed. They have to use that same active ingredient. And so the process to get approved is not as long or rigorous. This process started back in the 80s, and that was to help with the cutting down of costs because the brand name medications were very expensive. Today, we have about 80% of medications that are prescribed are generics. So, based on what the FDA has to say about these generic medications getting approved, everything has to be more or less the same. The things that are generally not the same are supposedly the inactive pieces of the medication. So that means they have to have the same active ingredients. So the active medication piece has to be the same. They go in the same strengths. They are the same type as like a pill or a tablet or a capsule. They have to be in the same route of administration. So whether it goes IV or it's taken by mouth or it's a topical cream. And then the indications and the half-life should be the same as well. So the most important thing we're concerned about is the bioavailability. So that means that whatever is mixed in with the active ingredients in this medication, we need to make sure that that doesn't impede the actual active piece of the medication. So it's still as bioavailable as the brand name version. So in general, the only differences are the inactive ingredients. So the label that the generic medication uses is essentially the same. So the drug label for the brand name and the drug label for the generic should look the same. It breaks down the ingredients, like the activity, the recommended dosing, all of that should be the same. Now, more recently, the FDA has also been looking into what these generic medications look like. So the current recommendation is that the pill looks very similar as possible to the brand name medication without actually like copying it. So that helps both providers and patients because they get used to seeing a certain medication, and when they transition from the brand name to a generic version of the medication, it looks very similar. All the different generic medications look very similar, so it's not confusing. If it's, an orange pill that's shaped like an oval, and we have another orange pill that's shaped like an oval, that's the generic version. That makes it very easy to keep track of what you're taking and what it's for. This is a relatively new recommendation. So for any medications that have been out there for a long time, just because they don't look like what the original brand name medication looks like, the FDA is not going to make them go back and make a formulation that looks similar to that brand name. That's going to be only for the new medications as they get approved. So the quoted acceptable difference is 3.5%. So that difference relates to the absorption of the medication, the active part of the medication. So there is a variance of 3.5%. And that can be within the name brand medication. So at the facility where they manufacture the pills, if there's a little bit of variation, that's considered well within reason. And the same thing across the different generics. So if one generic has a little bit more action or a little bit less action, as long as it's within that 3.5%, it's considered to be bioequivalent. So the FDA also has something called MedWatch, and I'll put a link to that in the email. But this is a place where people can report if they are having issues with their medications, especially if, they have a generic, like I was just switched, I was on the name brand and now I'm on a generic and I'm having all these problems and I think it's related to this medication. And then the FDA is supposed to investigate those issues that are brought up and hopefully address whatever concerns may be there. All said, things still may not go exactly as expected. So there's a good example of a medication that has had known issues over the past, I think about 13 or 14 years. It might even be longer than that. But the medication is Wellbutrin or bupropion. So those two medications, the brand name and the generic, they should be bioequivalent. But there are lots of instances where you can see reports from patients that they were switched from the name brand to a generic, and then they had either a lot more side effects or they were no longer getting the positive effect from the medication. And then the same thing within different generics. Some patients are on one generic for a year and they feel fine and they switch it, and 2 weeks later they're feeling much, much worse for whatever reason, whether it's lack of efficacy or increase in side effects. I mean, in theory, this shouldn't be a problem. I don't know why it's a problem. Personally, with my patients, we haven't seen that issue, but it can create a lot of problems for patients if you're used to getting something and it works really well, and then for whatever reason, the pharmacy gets a different brand in of a generic, and then they provide that, and then you have problems. So there is a way for patients to report this, so that's good to know. But if it comes down to the fact that it's the difference between a name brand and a generic medication, sometimes we can impact that and sometimes we cannot. So when I order medications for my patients in general, there's a little box to check that allows the pharmacist to make substitutions within reason. So that means like if I order Wellbutrin and there is no Wellbutrin, or if the insurance won't cover Wellbutrin, but they will cover the generic, then the patient will often get the generic. Sometimes I can make a special request that the patient only receive the brand name, but in many of those cases, the insurance will not pay full price for a brand name medication if there is a generic available. So that makes accessibility a real problem. So I just wanted to bring that to light. I don't have an answer for that specifically, but I do want to bring up that even though the FDA says these medications are more or less the same, they don't necessarily actually act that way for all patients all the time. Anyway, there's your answer about the bioequivalence between a generic medication and the name brand medication. Hopefully, it's the same thing. Until next time, Dr. B with Brain Bites.